Hello, everyone, and welcome to Conversations for the Common Good. My name is Tyler Whipkey. I'm the Director of Mission and Spiritual Care at St. Luke's Hospital in the Woodlands. And I am joined today, once again, by...
I'm Raquel Webb. Hello, everyone. It's nice to be together again. And I'm a Manager of Spiritual Care for our CHI St. Joseph Health System, which serves our Brazos Valley residents.
And we are thrilled to be with you today because we're going to be talking about something that is near and dear to our hearts, and that is Spiritual Care Week. You should be receiving this on Spiritual Care Week. It's always the last week of October every year. And this is the week where we get to celebrate our spiritual care professionals, our chaplains and our spiritual care volunteers, and all the folks that come alongside us as we do our best to offer spiritual care across the healthcare setting, both inpatient and some of us are even getting gutsy and venturing into the outpatient setting. So Raquel, I'm going to let you start us off and tell us a little bit about what is a spiritual care professional and why are they in hospitals?
Right. Okay. So this is very near and dear to me because I'm a chaplain. We're spiritual caregivers. And, why do we have chaplains in hospitals? Why do we have ministers in hospitals? You may guess, well, there's some sadness that happens in hospitals. There's two things. Joint Commission says that we should provide spiritual care to patients. So that's a pretty good reason. Another one that's a pretty good reason is the Catholic ethical and religious directives say that we should have spiritual care given to patients in Catholic hospitals. So two very important documents saying we should have chaplains here. But those two documents don't say very much at all about the taxonomy of what it is that a chaplain actually does and what their role should be. If you and I, Tyler, were to walk through our places where we work, our hospitals, and we ask different people, what is it that a chaplain does? What do you think? We would hear some different answers. The most popular that I hear all the time is, well, I know chaplains pray with people. And we know that the priest brings sacraments and anointings. And our chaplains, especially when someone's very sick and they're dying, they pray with them, they help them feel better. And that's often, yes, we do that. And I'm gonna ask Tyler for you to go ahead and share your screen. I just want to expand everyone's thinking of what it is that a chaplain does. So you go ahead and populate that. And as you click, yes, we do pray with patients, we provide sacraments, but there's so much more that we do and that we can contribute to the ministry that everyone else is doing in the hospital. We can help what the nurse is doing by walking alongside her and the patient. And I just want to expand your knowledge, that you who are watching here, of what it is that we do. We do much more than just pray.
And Raquel, as we're talking about expanding knowledge, because I know that one of the questions I often get asked is, how does somebody become a chaplain? And I don't know that that many people have a really full understanding of just how rigorous of a process it is for somebody to become a chaplain in a healthcare context. Would you talk us through that process a little bit?
I will. I think this is a very important thing for us to talk about because chaplains, they're not just ministers who got tired of working at the church. They're not just ministers that are unemployed and they found a hospital job. Chaplains are called to work in the healthcare setting, much in a way that a nurse might be called to her work or a physician might be moved to help people heal. Chaplains are called to this vocation to work specifically in healthcare. We have to be educated and trained for this setting. So I'll invite you to go to the next slide, and I want to go through some of these. So let me just make my screen here bigger. We have to be, first of all, official in our own capacity as ministers. And that means being licensed and ordained by our own faith traditions. And chaplains, we serve our entire population of patients, regardless of what their faith may be. And we serve them without imposing our own faith on them. We have to learn how to do that, because ministers in churches, they are often serving population of people with similar beliefs. And so chaplains have to learn how to serve everyone without losing our what we believe in and what's inside of us, but being able to connect to everyone and help each person find their own sacred being in their moment of sickness. We are educated individuals. We have bachelor's degrees. A lot of times chaplains have a background in behavioral sciences, or they may have varied other experiences that contribute to our work in chaplaincy. And then we have master's degrees in the study of theology or religion, or something that has prepared us to be at this point. And then we, in much the same way as a doctor goes through medical school, but then they have to do a residency, they have to practice and get experience while they're being supervised. Chaplains do the same thing, and we call that clinical pastoral education. And Tyler, I'm going to invite you to talk about the certification process that we go through.
Sure, thanks, Raquel. So the certification process that chaplains go through is fairly rigorous. I had the privilege of serving as the area certification chairperson last year with the APC for the Kansas, Colorado, and Missouri area. And in order to become a board certified chaplain, because we have two different levels, job titles within our ministry of chaplains, there are non-certified chaplains. And as you can see, the non-certified chaplains, those folks, they come in and they have 1 unit of clinical pastoral education, as well as the bachelor's degree and 5 years of ministry experience. And then board certified chaplains, whom there is a trend for most of our full-time chaplains to become board certified. We have to have 4 units of clinical pastoral education. We have to have at least a 72-hour master's degree or theology degree from an accredited seminary or divinity school. And then once we get all of that, then we have to sit down and we have to demonstrate competency in 31 different areas before a committee of our peers. And it is a rigorous process. And I want to take just a moment because Raquel, we need to celebrate you because you just had your committee meeting on Tuesday of this week. And you are on your way. As soon as you get the certificate, you will be the latest addition to the cadre of board certified chaplains among us. So congratulations on a job well done.
Thank you.
But that's just getting certified. And then once we're certified, we are expected to complete 50 hours of continuing education each year that we document and send in to our professional organization. And then we also have a peer review every 5 years. So it's not just that we walked in off the street and decided, hey, I want to be a chaplain. This is something that takes years and years of intentional study and preparation in order to earn the privilege to be able to go into a patient room and to work in the healthcare setting alongside all you fine folks.
Absolutely. And I just want to emphasize again that it does take a lot of work to learn this, because the needs of the spiritual and emotional needs of people who are in the hospital, both as a patient and as someone who works here, are different. Healthcare is really stressful. There's a lot of joy, but there's a lot of sadness. There's a lot of crisis, trauma, stress, and the chaplain is trained and prepared for all of that. And before we keep going, I want to still stay here in this moment of what it is that a chaplain does and how we do it. And Tyler, I'm going to invite you to share the next screen, because we really, and here I have a music sheet really, but everyone in the medical team, everyone is in the hospital very goal oriented. So for example, if a person comes through our hospital doors and they have pneumonia, the goal for the medical team is to return that patient as best as they can to a state of physical well-being. It's to restore their well-being. That's the goal. And the goal of the spiritual caregiver is the same. We all in healthcare have the same goal. Our goal is to aid the person in his or her well-being. And the chaplain does that by looking at the spiritual and emotional needs of the person and responding to the need that we see there. In Catholic healthcare, we know that health involves the whole person, the mind, the body, the spirit, and the chaplain is there to respond to the emotional and the spiritual. So the reason I have there that music slide is one of the ways that in my mind it helps me to think of how the chaplain does this is by accompaniment. And we accompany our patients and our team members through what they're going through in their crisis, in their health decline, whatever it may be. And it sounds kind of easy and kind of simple, you know, to say chaplains accompany. Because we can be walking, you and I, Tyler, and we're side by side, and I'm accompanying you through whatever it is you're doing. And that sounds easy. But musicians, anybody listening in who plays a musical instrument or has participated in a choir or an orchestra knows that accompaniment is not easy. It's an art. It takes a lot of practice. When you're a musician, you know that you're not the leader. You have to listen to all the other instruments being played. You have to take your cues from the conductor. And our patient is often the conductor, and we are listening and participating and accompanying. And it takes a lot of skill to do that. So that's one of the metaphors that I like to say of how the chaplain does our work, is that we accompany people and their struggles and their joys throughout all of life. I'll say here, while I was in CPE, one of my instructors told me that everybody who works in a hospital uses a specific tool. So the physician might use a prescription pad with their knowledge, and a nurse, the tool might be a stethoscope around her neck. Maybe the surgeon's tool is a scalpel, but the chaplain's tool is pastoral conversation. That's how we accompany our people. And chaplains are masters in the art of listening and responding. That's our music. That's how we do the work that we do, is through conversation and connecting the person to their spirituality, responding to their emotions. And it's not just patients. We accompany staff in everyday life. And as we return to just you and I, you can unshare your screen. But the last thing I want to say is that chaplains are really people who like other people. They like talking to other people and listening to other people. And in moments of crisis, the chaplains are the ones that run into a room and they like to pick out the people who don't look real well or who may be falling apart. And that's who we like to go to. So we can accompany them, help them, build them back up to where their well-being is in line with physical well-being, mental well-being, spiritual well-being. So I want to pause all my talking and I want to get a little personal, and I'm going to turn the conversation around, and I want to ask you, Tyler, why did you become a chaplain?
It was completely accidental, actually. So as I was in seminary, as I was working as a student pastor at a church, I used to hate and loathe hospital visits because I felt awkward and out of place, and I didn't know what to do with myself. And it was just a horrible experience for both me as the visiting minister and also for those poor patients in the bed whom I'm sure they were just ready for me to leave the room. In my tradition, I'm ordained in the Christian Church Disciples of Christ, and one of the requirements for ordination was 1 unit of CPE. And so I fought that kicking and screaming, put it off as long as I could until the ordination committee said, hey, if you really want to become ordained, you've got to get this done. So I found a CPE program, and I was going through my first unit, and it was amazing because I was actually being trained and given the skills on how to be a good pastoral visitor and how to be present well in that room at the time with people who need me. And a colleague in that unit, her hospital, it was Mercy Hospital in Sioux City, Iowa, was my first hospital. They were hiring for a PRN chaplain. They needed somebody for overnight coverage on Sunday nights. And I applied just for fun, and they really surprised me when they hired me. And it was there that I realized that this was really the area that I wanted to focus on, because when I was going into the hospital, every time the pager would go off, I knew that I was going to be called to a situation in which I could be helpful and I could make a difference in somebody's life. So that's the direction that I started moving towards. I eventually transitioned away from, well, I transitioned away from parish ministry. Even as a full-time chaplain, I often found myself in a bivocational setting, still preaching and pastoring congregations, but eventually healthcare chaplaincy became my primary vocational goal and my purpose.
So I hear even in your story there what I said, that chaplains have to be called to work in healthcare. And I can see in your story how through the things you were experiencing that you really were led to this work. And that's really, really cool. So tell us now, what is a day like for you as a chaplain and mission leader? What is it like in your department, in your hospital?
Sure. So here in my hospital, in our context of the Woodlands, we start our day with a huddle. Once the other two full-time chaplains arrive in the morning, and they sit in these two chairs behind me, we huddle in my office every morning. Of course, we're all wearing masks and being COVID compliant through all that. And we talk through the day. We take a look to see what referrals we have that are waiting for us in Epic. We talk through any other outstanding issues that might have come up overnight for the on-call or from yesterday that still need to be followed up on. And then we talk through our schedules, see if anybody has anything that might impact the rest of the group. And then we pray together. We always start our day together with prayer, and we ask how we can pray for one another because we think that that's very important. And we also pray for the rest of the folks that are in the hospital. And then after we break from huddle, we have unit assignments. So everybody knows where they're going and what patients are going to be checking on. And we round and we respond to referrals, and we take phone calls throughout the day, and we do our best to get through those in a timely manner. And then at the end of the day, we go our separate ways. There's always somebody on call 24/7. So we always make sure that the phone gets passed off to the appropriate chaplain, whether it's one of us that are full-time, or we also have some PRN chaplains who are extraordinarily talented, and they help cover on call for some nights and weekends. And then we gather together the next day and we do it all again. And I can't speak for my colleagues, but I love my job because I know that I get to make a difference, and I get to be present in those sacred moments, because hospitals are filled with sacred moments, whether it's the birth of a child, or even on the other end of that spectrum with the death of someone. That's a profound privilege to be able to be present there, or even to engage in a meaningful conversation with somebody about as we accompany them through their illness and their journey to wholeness and what that looks like. And it is I couldn't imagine a better job. I love it.
Beautifully said. And I would echo, I love my job. And I think most chaplains would say that they do. The work that we do, getting to participate in the lives of our care seekers is really meaningful. So I agree.
All right. Well, I think we are at the end of our time for today. Raquel, as always, it is a pleasure to be with you. For those of you who are listening in, We're going to continue this conversation. We may be slowing down the pace just a little bit, going to from a weekly delivery to maybe a once every 2 weeks. And also, we would love to hear from you. If there's a topic that you would like for us to talk about that you would find meaningful, feel free to find either Raquel or myself in the global address list in Outlook. We're there. We would love to hear from you because we want to make sure that this is something that is meaningful to you all as you go through your everyday work, doing fantastic jobs, making the healing presence of God known to our world. So thanks again. Have a great day, and we'll see you real soon.
And to all the chaplains listening, happy Spiritual Care Week to you.
Bye.